of cardiogenic shock. Ensure adequate airway and ventilation. If required, intubation and mechanical ventilation as maintenance of adequate oxygenation is required to ensure adequate myocardial oxygen delivery. Electrolyte abnormalities, commonly hypokalemia and hypomagnesemia, should be corrected. Intravenous morphine sulfate or fentanyl for pain. Dysrhythmias and heart block must be treated with antiarrhythmic drugs, pacing, or cardioversion if necessary. Dobutamine stimulates cardiac beta-1 receptors to increase cardiac output, but may also vasodilate peripheral vascular beds, lower total peripheral resistance, and lower systemic blood pressure through beta-2 receptors. Ensure adequate preload and intravascular volume is essential before starting dobutamine. Dopamine stimulates dopamine receptors, vasoconstriction, beta-1 receptors, cardiac stimulation, beta-2 receptors, vasodilation. Dopamine is preferable to dobutamine in treatment of cardiac dysfunction in hypotensive patients. Catecholamines must be used carefully. Amrinone and milrinone, phosphodiesterase inhibitors, are used in resistant cardiogenic shock. Intra-aortic balloon pump in case of patient refractory to cardiotonic. Anticoagulation and aspirin in acute myocardial infarction. Beta blockers are used to control heart rate and reduce myocardial oxygen demand. Nitrates help to increase coronary blood flow through vasodilation. Angiotensin-converting enzyme inhibitors are used to reduce angiotensin-converting enzyme-mediated vasoconstrictive effects that increase myocardial workload and myocardial oxygen consumption. Percutaneous transluminal coronary angiography with stent placement is recommended in acute myocardial infarction.